Welcome everyone to GW Resiliency and Wellbeing Center Women's Wellbeing Lecture Series. My name is Victoria Karakcheva, and I want to mention to you that this event is made possible for you because of the generous support of Dr. Rosemary Bose, PhD, who is an assistant clinical professor in the Department of Psychiatry and Behavioral Sciences and Obstetric and Gynecology in the GW School of Medicine and Health Sciences. And also, I want to say that our speaker today is a wonderful, wonderful supporter of women's well-being and also our well-being champion. And she's going to talk to us about menopause and perimenopause. Her name is Lara Williams, and she is a board certified in both OBGYN and integrative medicine. She's currently is the managing partner of the Oregon Clinic, which is an OBGYN North location in Portland, Oregon, where she provides a holistic approach to women's healthcare issues, including obstetrics. She's passionate about education for both her patients and students. Dr. Williams' philosophy is to build a partnership with women in promoting physical and emotional health through nutrition, exercise, and medicine, while exploring both traditional and alternative routes. I'm very excited to learn from her wealth of knowledge and expertise. So with that, I'll pass it to Dr. Williams to dive into a wonderful world of perimenopause and menopause.
Good morning, afternoon. I don't think anyone's on evening yet. So this is a topic that's near and dear to my heart, partly because I'm living it, and partly because the number one reason that I have a patient presenting into my office right now is perimenopause and menopause. And I love that we're having these conversations finally. Like, I never stopped having these conversations. I practiced since the Women's Health Initiative, which kind of changed how we looked at menopause, and really for a while there weren't actively managing it in a way that I feel needs to be managed. But what I wanted to talk about is what I'm finding now is that everyone, kind of like weight loss, there's, one thing that everyone's doing for weight loss. I feel like everyone is looking for that one thing for how to manage a lot of the symptoms. And my argument is it's not always the ovaries' fault. Like, all of the symptoms that plague us in the menopausal and perimenopausal milieu. I call it a milieu because it's such a multi-layer, giant process that is so involved in so many different things that I want people to be thinking outside of just like, oh, I just need to get hormones, because in a lot of cases, that's not actually the next step. Okay, so let's talk about symptoms that we see in that are often associated with menopause and perimenopause. Fatigue, brain fog. I'm getting a lot of those. Like, the ones on the left are what I'm getting a lot of people presenting with, more than the ones on the right, actually. The fatigue, the brain fog, poor recovery, especially in my athletic patients, muscle fatigue and pain, joint pain and discomfort, poor libido, lack of drive, like just motivation, those kinds of things, and night sweats. On the other side, I'm seeing not as many. These tend to be more when I'm seeing people in menopause, which is the hot flashes, skin changes. I'm getting more requests for estrogen facial cream than I have ever seen before. And I can usually tell what's going on social media based on what's presenting in my office. And so I know that my patients have informed me that that's a big topic on social media right at the moment. Vaginal dryness, pain with intercourse, and hair loss. And again, these symptoms are very broad and wide-reaching. And yes, there can be a hormonal component to this, but there's also other components which we're going to talk about. Other symptoms, again, I divided these kind of into left and right because the stuff on the left side I see is just more universal symptoms that are, again, always laid at the feet of the ovaries. And one of my students actually she said, okay, your thing for today is, do I think it's perimenopause? No. Do I think it's HPA axis? Yes. And we're going to talk about what the hypothalamic pituitary adrenal axis is as we kind of move on. But it is, in my opinion, the root of so many of the menopausal and perimenopausal symptoms, which is why hormones can improve when we're in menopause. Those hormones can help improve the symptoms, but aren't always the end all be all. And especially in perimenopause, in my opinion, especially estrogen can make things much worse. And I learned that through a lot of trial and error. So symptoms on the left, the weight gain, the anxiety, depression, sleep disruptions, and then on the right, body odor, breast changes, urinary incontinence, and irritability. Again, I've seen them go back and forth. This slide is more of I see these apply in multiple realms, but I want to kind of throw forward what I'm seeing most often as people are discussing as they come in. Thank you. So I get, it must be menopause, or is it? And so one of the things that we talk about is, what is the definition of menopause? The definition of menopause is the absence of periods for 1 year. So knowing when your final menstrual period is incredibly important. So I always tell people, keep track. Even if you're like bleeding sporadically, it's really important, because a lot of times we use that to differentiate between menopause and perimenopause, or even postmenopausal bleeding. And all three of those categories need very different workup. So we really want to know where people are. Typically in menopause, we're seeing an elevated FSH. The lab criteria puts 25 and 30. Yep, if you're somebody who's got premature ovarian insufficiency, yep, we can 100% see that. But typically it's an elevated estradiol, like 65, 70. I've even had people at 140, and typically it has a low estradiol level. I'm one of those people who checks labs because I'm trying to figure out, because with IUDs, with hysterectomies, with ablations, the picture's not always clear. The guidelines that are coming out of the major societies are not recommending testing labs. They're recommending testing or treating based on symptoms. The problem I've had is my first patient, who I learned so much from, who I treated based on symptoms and then got labs when she wasn't getting better, had an estradiol level of 1,000. She's not somebody who needs more hormones. And so what I learned was, everything that presents with symptoms is not necessarily hormonal related. And in her case, I made her symptoms worse by giving her additional hormones. So that's kind of where I started asking more questions. And I think that holistic approach to women's health, I have lots of questions. I'm constantly trying to figure out, how do I get my patients feeling better? Because when you're in the middle of brain fog and fatigue and weight gain and loss of libido and all of those things, it is really problematic. Like, it really does feel awful. So, all right. So, well, if it's not menopause, it must be perimenopause. And this is the hottest topic, which I'm so thrilled that we're having conversations about perimenopause. But again, everything that has symptoms isn't necessarily associated with perimenopause. So we want to kind of be able to look at the whole picture. So perimenopause is defined as the period of time where those hormones start to change. Typically, we start seeing cycles change. So if we're having regular cycles, and cycles are every 26 to 32 days, even if they vary month to month, we're still having regular cycles. We're still ovulating. We're still producing the hormones that we want to be having. When we talk about early treatment of menopause in the perimenopausal period, the data is really defining that as 6 months after the final menstrual period. So when you look at the literature, when they're talking about early treatment of menopausal symptoms, they're using the definition as 6 months after the final menstrual period. So I want to kind of put that into the frame of mind. And again, perimenopause can last 2 to 10 years. I really see this in my patients with premature ovarian insufficiency. Those are the folks where the FSH is starting to go up earlier, the estradiol is coming down earlier, but they don't just stop. It's one of the reasons that the literature changed from calling it premature ovarian failure to premature ovarian insufficiency, because it's more of a spectrum instead of a finite stop. Do I have people who look like premature ovarian failure? Yes, they tend to be my patients who their final menstrual period is when they're 19, 20, or 21. So they're very different than my patients who are in their 30s. So, and again, cannot emphasize this enough. You can still achieve a pregnancy in the perimenopausal time period. One of the big questions I get asked is, okay, so somebody's in perimenopause and their doctor offers them birth control pills. Well, why couldn't they do hormones? Because hormones are actually less than what's in birth control pills. Well, there's two answers to that question. Answer number one is that in the perimenopausal period, people can still become pregnant. So that needs to be on the contraceptive management plan in people who are not desiring future fertility. The second thing is when you're put on birth control pills or anything that interferes systemically from a contraceptive standpoint, the ovaries are kind of taken offline. So the ovaries are not still producing what they were producing. So if I've got somebody who's perimenopausal and is very symptomatic because their estrogen is actually high, not low, which is more of what I see. I see more patients coming in with more symptoms, especially of irritability, anxiety. A lot of my patients just describe it as I don't feel like myself. I'm finding that their estrogen levels are 300, 500, 700, 1,000. And so I don't tend to put people on birth control pills, but I can see the utility of that if that's one of the tools in your toolbox. That what it does is it takes those ovaries offline. So that signal from the brain, the FSH is not going to be sending a signal to the ovaries anymore. It's going to take it completely offline. And if you check labs on people on birth control pills, their FSH will look like it's in the single digits and their estradiol will usually be below 20 because it is taking it offline. The birth control pills themselves are inserting themselves in that signal process. So, if it's not all hormone driven, what else could it be? So, the way I kind of think about that is as we reach a certain number of birthdays, we lose some of that protection of what we were having with those nice regular cycles. I find that that protection starts to change in the mid 30s. Part of it is our fertility, is starting to wane starting at 23, 24, like that's our peak, and then we're waning after that. In the mid 30s, what I find is the discrepancy between what the ovaries are producing, that estradiol level, and what the progesterone is being produced starts to widen. I see a lot of people in their mid 30s start presenting with PMS symptoms, PMDD symptoms, which is PMS on steroids, and really starting to become a lot more symptomatic. We're having a lot more physical signs heading into the menstrual cycle, as well as emotional signs heading into the menstrual cycle. So I want to put that on people's radar because I do see that quite frequently. And so it's that change in the hormones. The estrogen levels are still fine. This is not a low estrogen state. That was the biggest aha moment for me, was realizing how symptomatic women are when their estrogens are high versus when they're low. And if I have a patient, and I've asked my patients who've been high, who are now in menopause, and said, all right, which process was more unpleasant for you? And across the board, the folks that were high have said when they were high, they were much more miserable than when they were low. Low was something that they knew something was different, but their symptoms were not as bad as when they were high. Okay, so a lot of the things, and when in looking at the holistic picture, we have to look at the holistic picture. So we want to look at all of the things that we can control. Again, I feel like I get people who want me to write a prescription, but when I start really diving into what is the root cause of what's going on, everyone looks at their birthday and says, okay, I'm 46, I'm 48, I'm 51, I'm 53. It's got to be this. I actually had a patient who still having regular periods at 52. I have lots of patients who are regular having periods in their late 50s. So the age of the patient doesn't determine where they are in the process. It is a clue, but it is not definitive. When we talk about average age of menopause being 52, that means I'm going to have, if I've got people who are 19 and 20 having had their final period, then I'm also going to have people at 56, 57, 58 also having their final period. So it's really important to know where you are. Again, there are things that take that offline, an IUD, an endometrial ablation, a hysterectomy, which makes it harder, which is why finding somebody who's very comfortable managing menopause and answering all of those questions is really important. But let's talk about what are the things that we can do in the here and now. And I don't care what phase of life you're in, these all matter. You want to know about how is your daily, what are the things that we're doing daily to make sure that we're taking care of ourselves? Knowing if you're a morning person or if you're a night owl, and actually knowing if your body is the same. I have plenty of people who tell me they're total night owls, but when I get their sleep data, when I check in on their, again, I love wearable technology um, for figuring out, is what you think working actually working for you. I use an Aura ring. I have found it to be a game changer in helping me to figure out, for instance, one of my big tools that I learned was when I'm on call and I get home, it's actually better for me to go through my wind down routine the way I do every other night. Even if I go to bed 45 minutes later than I think I'm going to go to bed, I will actually get better quality sleep and I will feel better the next day. And my Aura ring validated that for me. Like, there is the what you want to be true, and then there's what there is that is true. And I am guilty of that, as many women are, of what I think is working for me versus what actually works for me. So I'm a person that I get up early. I have always been a morning person. My Aura ring has verified that. It matters what time I go to bed. The later I go to bed, for me, going to bed later is the equivalent of me having alcoholic beverages. It has that kind of impact on me. How are you eating? Are you eating protein-rich foods? Are you skipping meals? Are you getting your vegetables? Are you getting your fiber? Are you moving your body? With so much online and on Zoom, are you moving your body? I actually have a little peddler that I keep below my desk because I pre-chart in the morning. And so that way I've actually got some physical movement going into my body. With all of the online work from homes, I've found that there have been a whole lot of new resources for people to be able to find things to keep them active while they're sitting at their desk. Are you scheduled for too many things? Like, are there too many things going on? That is something. And are you doing things that bring you joy? Like, are you doing things where yes, like I feel happy, I feel content. I am looking forward to things. It's so important that we have things on our regular daily activity that brings us happiness and joy. All right, sleep. One of the first questions I ask my patients, especially when we're dealing with brain fog and weight gain, and lack of energy and lack of drive and lack of libido, is what's your sleep look like? Ideally, you want to be 8 hours of more of sleep, but you also need to have good quality sleep. 25% of your sleep should be deep sleep, and 25% of your sleep should be REM sleep. When I'm looking at, I heard the best way to describe deep sleep is it's kind of like a facial for your brain. And that is one of those things for me that I'm constantly working on. That's the marker that I struggle the most on, is my deep sleep. So knowing where your data is, because I have plenty of people who are like, no, my sleep is great. Okay, they got 9 hours, but they got 45 minutes of deep sleep and they got an hour and 10 minutes of REM. They're not where they need to be out of that 25%. And if I ask them how they're feeling when they wake up in the morning, are they feeling rested? Are they feeling like they're ready to start their day? No. So it's not just quantity. And this is where wearable technology is really helpful, to start figuring out what is getting you more deep sleep, what is getting you more REM, and more importantly, what's taking away from that. It was really interesting. I had a lovely conversation recently with one of my patients, and she was like, the alcohol on the weekend is killing me. And I didn't know that it was affecting me as much as it was until I, like, intuitively she knew, but it's part of her social life and social activities. And then she got her sleep data and she was like, it's trashing me. my sleep data is better during the week when I'm working and running all my routines than on the weekend when I'm having alcohol. The other thing is, I've had lots of conversations with patients and they're getting into bed at a reasonable time and then they're scrolling on a device for the next, 1 to 2 hours. Part of that is it's recognizing what it is that you need to unwind. And so a lot of times that's you're not ready to unwind, but is a device really going to be the best thing for your brain to unwind, especially if you start looking at the blue most devices have a nighttime mode that you can turn them to so that you're not getting all of the blue light. You can wear blockers because part of that is it activates your brain. Just like when we get on our phone as soon as we wake up in the morning, it's also not allowing us to kind of come into the day. And we talked about the increase and decrease. So I cannot overemphasize the importance of sleep. Sleep is, we are really good about making sure, at least I am in my household, about making sure my children are getting good sleep because they're monsters when they don't. And they've always been that way. But I think that we also need to apply that to us. And a lot of times when I'm looking at my patient's sleep data, it's amazing how many people have got a 4-hour chunk several times a week, or they've got a 7-hour chunk, but their REM and deep was only 25% in total, not 50% of their sleep. So it's really knowing what your numbers are and how to improve those numbers. Sleep habits. Oh gosh, it is so, so important. And it's also knowing what sleep habits you need. Like I'm giving general, but what I find with sleep data, when you're actually having your own wearable technology, you know what your numbers are. And what I always tell people is there's the general stuff that we talk about, but it's also knowing your own numbers. This is making sure that you are in a dark room. I wear an eye mask because my husband needs to have the blinds so that the light starts to come in and wake him up naturally. I'm so sleep deprived over 25 years of taking call that I am so light sensitive. So that's been our compromise is I wear a mask and I'm much happier. You want to have the bed at the right temperature. You want to be using your bed for sleep and sex, not for all of social media and television and everything else that we do when we're not sleeping. We want to know that is your partner snoring? Like the number of patients that I have who say, I sleep great, but my partner starts snoring at 2 o'clock in the morning and then I'm trashed. There's a much higher rate of sleep apnea in women who, as we transition through into the perimenopause and menopause time periods. And do you or your partner need a sleep evaluation? Do you have a REM sleep disorder? Do you have sleep apnea? What's going on? So all things sleep related, and we had a lovely speaker on sleep, and you can look through the archives. She went through all kinds of different things to be thinking about with sleep. I am sending more and more patients these days for a sleep evaluation because it is a much bigger deal than we've ever given it credit for. Let's talk about things that disrupt sleep. Alcohol. If you look at the number of celebrities who are women in their 40s who've stopped drinking, it's extraordinary. And I didn't understand it until I was in my 40s and realized how much alcohol affects my sleep. And it's blood sugar dysregulation. Alcohol, a lot of people have a glass of wine as they get closer to bed. That's a giant sugar load right into bed. We wouldn't necessarily have, a candy bar right before we go to bed, but we will have alcohol. And so that disrupts immensely. Caffeine, knowing if you're a slow metabolizer. Like there are people who the caffeine they had at 9 a.m. is still affecting them at 9 p.m. And then there are the people who can have an espresso shot and then go to bed. So knowing how you metabolize is really important. And caffeine, especially in the slow metabolizers, has a negative impact on cardiovascular disease. So I'm a slow metabolizer, so I have to really watch my caffeine because it will impact my cardiovascular health. Are you exercising too close to bedtime? A lot of people are trying to get try to get that exercise in, but then they're actually elevating everything heading into sleep. Stress, social media, emails. Like I have a rule where I don't check email after 7 p.m. because what it does to me is it keys me up. And my Aura ring called me out on it because I had a night where I slept terribly, and I had broken my own rule. Eating too late. That is an immensely disruptive for so many people. They're uncomfortable. They have heartburn. They just can't get comfortable. And then work shifts. Those of us who take call, work shifts, really do have an impact. Things that we can do to improve sleep. Relaxation techniques, getting off of our devices, having consistent sleep-wake routines, all of those really do matter. So figuring out what it is that your body needs, what is it that you and your family need? Like, these are great techniques for also for children. Like, when I was doing my master's, I was looking at depression in women. And one of the things that was so impactful is, especially in girls, they were showing that how many hours teenagers, it was both men and women, who were on devices was impacting their emotional health, their well-being, being on it right before they went to bed. And I kept thinking, okay, that doesn't go away as we have more birthdays. It's not like all of a sudden our brain can now adapt to that. So it's really being accountable to yourself and saying, all right, these things that I do, am I doing it because I'm bored? Am I doing it because I'm anxious? What is it fulfilling here, and what is it could I do as a substitution that's actually healthier for me? Okay, symptoms of poor sleep. If we think back to those first slides, fatigue, brain fog, weight gain, irritability, poor sugar habits, poor dietary eating habits, blood sugar dysregulation, all of these are indicators of poor sleep. And if anyone ever thinks, I think back to when I was, breastfeeding every 3 hours, like, I was so carb craving. I felt like a zombie of myself, like I couldn't get weight off. When they talk about breastfeeding, just pulling it all off. And part of that was because I was up every 3 hours. I had a preemie, and he was not a good sleeper. He's not supposed to be. He was little. And it all matters, but it's looking at, again, I want to focus on root causes of what is causing us to feel the way we're feeling. Yes, can hormones play into all of these? Absolutely. But hormones, it doesn't tend to be all or nothing. There often are multiple factors at play, and we want to get down off of these factors so that when we use therapies, they're more effective. All right, let's talk about diet. I cannot emphasize how important it is in the perimenopausal, menopausal years, and in women in general, on getting enough protein, especially my athletic patients. It's so important. I find that protein for so many women is so restricted. I usually tell people in perimenopause and menopause, I want to see them shooting between 90 and 95 grams of protein a day. We've got to keep our muscle mass to protect our bones, to protect our metabolic rate, to protect our ability to age. I see a lot of skipping of meals. Like, I usually tell people I want lunch to be their biggest meal. Like, we're using the bulk of our calories by 2 p.m. I want the most of the calories coming in breakfast and lunch. If we're going to have a light meal, I want it to be dinner. And in the United States, I tend to find that breakfast is lunch is and then dinner is huge because it's a family meal, which I understand. And we still need to be nourishing our body throughout the day. Like, I watch so many people skip breakfast. I watch so many people skip lunch. And I tell people, if you're going to skip a meal, skip dinner, because usually what's happening is people are eating too late. They're not eating good things, or they're eating too much, which is then disrupting everything else down the stream. You got to be checking in on how much alcohol you're drinking. As a female, for cardiovascular health, and the data on this is starting to change. The data has been a half a glass a day is where you want to be for cardiovascular health. I'm seeing more and more stuff starting to come out, really saying, okay, wait a second, is this actually what we're getting for our cardiovascular wellness equal or greater than what it's doing as a toxin to the body? So knowing what you're drinking and how much you're drinking, also your carbohydrate balance there. So a lot of the wine and beer are heavy sugar loads. And so especially if you're having those outside of a meal, if you look at the blue zone data in the groups that drank alcohol, they drank it with meals. They're not drinking it on the couch at 10 o'clock at night while they're flipping through the remote or scrolling through their phones. Are you feeding yourself nourishing foods? There are food services. Like a lot of people need help. They need something that they can pull out of their refrigerator when they're going to work so that they actually have a lunch meal. There are lots and lots of services out there that are selling meal prep kits or food that is, present that you can, like I have food dropped off on my porch on Monday mornings, and that is what I pull out of my refrigerator for the week while I'm working. And it has been a game changer. It also allows me to think ahead, and the service I use does high protein, really good foods that are balanced and healthy, and it meets my dietary needs. But I cannot tell you how important food prep and having those options, because there's nothing worse than being somewhere and being like, I didn't bring anything, I'm hungry, I'm pressed for time, I'm just gonna push through, or I'm gonna grab a coffee, or I'm gonna grab a soda, I'm gonna grab a handful of a bag of chips. And we're not feeding our bodies, which leads us to feel terrible. Those blood sugar imbalances impact everything. When we're breaking our fast, again, breakfast is breaking of the fast. Are we breaking it with protein-rich foods? Like I find so many people in breakfast are having less than 10 grams of protein. And I want to see that 30, 35 grams. There are lots of cheaters. One of my favorites is collagen and coffee. I'm not a coffee drinker, but that's a lot of way I sneak protein into a lot of my patients. I'm a morning shake person. I have found that it works really well. I'm not super hungry in the morning, but I know that I absolutely need to have protein because my brain tells me when I don't get enough. Really important to be thinking of how you're starting your morning off. Ideally, you want to be done eating 3 to 4 hours before you go to sleep. You want to go to sleep on an empty stomach. You want to have that fasting process to start, but also you don't want to have increased reflux and all of the things that happen with a gut that can't digest all of the food. Are you going to bed hungry? Is that impacting how your sleep is going? Because being hungry or being too full, both can impact sleep. So are you somebody who's got a fast metabolic rate and you actually need to have a little protein snack right before you go to bed so you don't wake up at 2 o'clock in the morning starving? I see that a lot in my pregnant patients. So blood sugar dysregulation can lead to diabetes and prediabetes. This is one of the things when I'm working a patient up with all of the symptoms that we've talked about, I'm checking an average blood sugar, and the number of patients I'm finding that are between 5.7 and 7 is not few and far between. Like I'm seeing a lot of people because blood sugar dysregulation can present as night sweats. I always say if I've got somebody who's still having regular periods and they're having night sweats, it's either blood sugar or stress 9 times out of 10. It's not, for me, it's not hormones. Often it's alcohol that is causing them to wake up at 2 or 3 o'clock in the morning in a sweat. And a lot of that's coming from blood sugar dysregulation. Are we having insulin resistance? If you've got somebody who's got polycystic ovarian syndrome, which is a lot of us know when you are that person. So that can present as irregular periods. It can present with elevated testosterone levels, but it also has a huge impact on blood sugar, diabetes, prediabetes. Also hypoglycemia. So if you have something that is a large carbohydrate meal, your body will push out a bunch of insulin to bring those sugars down. Well, what'll happen is it'll overcorrect. And now you're having low sugar. And low sugar can feel like brain fog. It can feel like getting shaky. It can feel like breaking into a sweat. So that can happen at 3 o'clock in the morning. I see that a lot when I'm watching people's continuous glucose monitor, is that I see that you get this spike and then they go past baseline into the bottom and they don't feel good. So what are symptoms that we see from the brain when we're having all of these ups and downs? You can have, as I said, the feeling hot, sweaty, faint. Brain fog is a big one. We talked about the night sweats, irritability, fatigue, and weight gain. Like it is really, really noticeable on how this impacts things. So are you moving your body? So if you look at this, is really when you look at the blue zone, and if people are not familiar with that body of work, it's lovely. It's looking at large groups of people that are centenarians, which I think is a lovely goal. Is if I'm going to live to be 100, I want to live to be a vital 100. I don't need a number to be the number that passes. I want to still have a vibrant life. And these are groups of people that are living vibrant lives as 100-year-olds. And they all are moving their bodies. And they're not hitting CrossFit, they're not hitting Orange Theory. They have incorporated movement into how they live their life. So they walk places, they take their bike places. They are actively moving through time. And in moving your body, you can overdo it. So if you are somebody who is not feeding yourself and not sleeping and then exercising 2 to 3 hours, your body is not going to be able to recover. So exercise is great when you have left the foundation for it, to making sure that you've got all the tools on the toolbox to be able to be successful in your exercise and athletic pursuits. Also, exercising too close to bed can really disrupt sleep. Some people find, I've been told by a lot of people that it improves their sleep, but really look at that data. I think a lot of people, they do need to exercise, but if they exercised a little bit earlier in the day, I think that they would actually see better improvement in their sleep. But a lot of times it's people trying to cram it in where they can. So it's also being thoughtful. Like I get it. Like there are X number of things that need to be done in a day, and you have X number of hours in that day to try to get those things in. This is where finding what your personal data is saying is really important. And figuring out, like, is what you think happening, what your body is also confirming is true. The biggest thing that I tell people is movement should be about having you feel better and healthier. I have plenty of people who are doing physical activity because they think it's good for them, and they are exhausted, they're getting injured, and they're miserable. That now has taken a good thing and made it not a good thing. So it's really important that we are doing things for the right reasons, with the right tools, so that we're setting ourselves up for success. Overscheduling. I gave a lecture, probably, I think it was last year, on the power of saying no. And I cannot overemphasize how overscheduled we are as a population. We have so many things on the calendar. And I always tell people, Marie Kondo your calendar. Is this bringing me joy? Is this something that I am enjoying doing? Or is this something I have to do? There are things that you have to do. You got to go get your teeth cleaned every 6 months. Like that's a have to. But do you need to sit on this committee that was bringing you joy and is no longer bringing you joy? Do you need to be your kid's homeroom parent? Are you enjoying it? Is it bringing you happiness and contentment? Or is it another thing that you feel like you have to do? I'm a big fan of white days, of just having a day regularly that has nothing scheduled on it, that it is 100% you wake up and decide what moves you to do that day. They're hard to do in modern society with all the commitments that our families have, but try them. They're really lovely at helping reset and rebalance. Do you have a mindfulness or gratitude practice? Those are also really important. We want to take time. There are so many positive emotional, physical benefits of taking time for mindfulness and gratitude. There's a weekly mindfulness series with George Washington's Resiliency Center that has lots of things that go through it, and it's so important. Okay, I told you we would get to this HPA. So the hypothalamic pituitary adrenal axis, I find, in my personal and clinical opinion, is one of the biggest offs of things that are off in the body that are presenting with symptoms. This is our fight or flight response. So what ends up happening is as we need to ramp up, our body produces more cortisol. Cortisol is fine in doses that then come back down. If those doses aren't coming back down, now what we're doing is we're bathing our brain in cortisol. So our body says, look, this is not a good plan. If we keep turning this switch up, I'm going to blow a gasket. I think of the brain as kind of like a motor in this case. I'm going to blow a gasket and I can't just rehab that gasket. Like that's not going to work. So the brain starts to turn down the body's ability to produce and rev up that cortisol. So they used to call it adrenal fatigue, but that's not really what's happening. It's not like the adrenals can't produce it. The adrenals have been downregulated so that they can't produce it. So stage one is usually that stressed and tired, stressed and wired. Sorry, stressed and wired is stage one, and people know what that looks like. You're getting by on less sleep. You're able to get stuff done. You're feeling a little stressed, but you're still able to accomplish. A lot of people who are movers and shakers love phase one because they're able to get a lot done. Problem is phase one can lead to phase two, which is stressed and tired. Now we're starting to, I describe it as it's like putting a speed regulator on that engine that now you can't go over 55 on the freeway. And if you need to go faster because there's an emergency, occasionally the body will let you do it, but a lot of times it won't. And then stage three is down and out. Now the body has really kind of limited where you can go. I describe it as you can't go over 25 miles an hour on the freeway. And anyone who's ever had an engine issue on a freeway doing 25 miles an hour, it's painful. It is just painful, painful. So symptoms that I see with this more than anything is this is the brain fog. This is the fatigue. I start seeing a lot of blood sugar dysregulation. I see poor sleep. I'm seeing a lot of pain and inflammation in this, and I'm seeing weight gain, especially the abdomen weight gain. When I've got patients who are like, look, my weight hasn't really changed, but I can't button my pants. This is one of the first places I think of. And I think that so many of our perimenopausal and menopausal symptoms are being driven by this. And I think it's why for some women, even starting hormones, a lot of their symptoms haven't resolved because we're not treating all of the things that are going on. Thyroid disorders. Thyroid disorders are commonly diagnosed in women in their 40s and 50s and younger. They are master mimickers because we're talking about big endocrine regulator systems. The hypothalamic pituitary adrenal axis is a big endocrine regulator. So is the thyroid. And thyroid symptoms can often present very much like, if I've got somebody who's having irregular periods, thyroid, I'm always checking. And I'm also checking antibodies. People with Hashimoto's thyroiditis, and that's going to be low thyroid plus antibodies. But often they will start with antibodies first. And so they are now predisposed to heading toward a thyroid condition. Thyroid conditions can be the dry skin, weight gain, fatigue, brain fog. Oh gosh, brain fog. I have thyroid. I have Hashimoto's. I did my whole first year of medical school without thyroid medicine, and talk about tired. Like I didn't understand what tired was. And I kept being told I was a med student. And finally somebody asked like, well, have you ever had a thyroid problem? And yeah. Okay, were you ever on meds? Yeah. Well, I took myself off because I didn't quite understand why I was on it, which, patients do this. And there I was. It can cause loss of the lateral third of the eyebrows. It can cause hair loss. It can cause heat cold intolerance. So thyroid has to be on our list. And we'll also see overthyroid, which is Graves' disease, which can be anxiety, irritability, weight loss, palpitations. A lot of the same things that I see in this perimenopausal and menopausal, I see lots of thyroid here too. I cannot underestimate the power of low iron. In my clinical practice, the number of menstruating women that have low ferritin levels, so up to date, says any ferritin below 30 is considered iron deficient, and most likely the ones below 50 also are. Most of the labs in the country are using 9 and 10 as the bottom levels of ferritin. That is not where low iron is. I'm finding that this really does, like the number of patients who've come in, often this presents with somebody who's worried that they're developing early Alzheimer's because they've got a family history, they feel super off. Or my patients who are like, look, I can normally hike and run and do all of these things, and I just can't. It's usually presented in the face of something else, heavy periods, celiac disease, those kinds of things. But I see a lot of restless legs with this. I see a lot of brain fog with this. I see a lot of fatigue with this. So I have a low threshold to check people's iron levels, and I check them as ferritin. Ferritin is the most representational of the iron stores, and it has made a really big difference in my population. Where it really became noticeable was in my pregnant patients. And then I try to apply things that I'm learning from one group of patients across to another. And so that's kind of where I saw that. ADHD, again, we've had speakers talk about ADHD. It is often underdiagnosed in women. Women who are now hitting their perimenopausal, menopausal years are often it's resurging. Like all of a sudden they're having symptoms that they've kind of been able to cope and manage for decades, but now they're not coping and managing. They're having job performance issues, they're having trouble running their lives. So October is ADHD Awareness Month. I've got some resources here on how to test. It is so important if you think you might have ADHD, especially if you've got kids with ADHD, like it should be on your radar, like, oh, maybe this is me. Or if, you were, and again, women don't often present in the hyperactivity. Oftentimes it can present more like anxiety and more emotional components in our teenage years. And then in our perimenopausal, menopausal years, looking more like difficulty concentrating, those kinds of things. So if this resonates, please, this needs to be on the list. Like I see this so commonly, especially in people who are lacking drive. Like they're like, this is starting to impact my job performance capacity. I am concerned. Please, please dig into this. Okay. So now what? Where are you in the process? If you have not had periods for more than a year, and this is, you don't have an IUD, you don't have an ablation, you don't have a hysterectomy, that's the definition of menopause. If you are still having regular periods, that's not perimenopause or menopause. That can be PMS, that can be PMDD, that can be something else is going on, but that is not perimenopause or menopause. If you're starting to skip periods, if your cycles are, now down to 21 days or 23 days, or, they vary between 23 days and 47 days, that can be perimenopause, that can be thyroid, that can be polycystic ovarian syndrome, and that can be pregnancy. Like, let's remember that until you have gone one full year without a period, you still have the potential of becoming pregnant if you have a uterus. So what I encourage patients to do is find a practitioner who is comfortable and knowledgeable on menopause. The Menopause Society, which used to be the North American Menopause Society, they've now changed their name and have rebranded. They're still under menopause.org, is a fabulous resource for both patients and providers alike. Estrogen Matters, that is written by Dr. Blemming, and he references the studies that really talk about how we need to be thinking about estrogen based on data that's outside of the Women's Health Initiative and why there are so many positive. Let's Talk Menopause is also another really, really good resource to get more knowledgeable and more educated. What are other things that you can do in the meantime? I'm a huge proponent of acupuncture. I've been doing acupuncture for 20 years. I credit it with helping me be pregnant, helping induce me, helping me keep my uterus, helping manage so many of my symptoms. Thousands of years of Chinese practice has got lots of data and lots of things to help manage symptoms. I have so many patients who have breast cancer, who are unable to take systemic hormones. The other options that they haven't worked, and acupuncture has been a game changer. Having practices that we do to take care of ourselves, prioritizing ourselves. What is it that we need? Do you need to have a mindfulness practice, a gratitude journal? Do you need a daily movement practice? Do you need to have vacations where you look forward to and are planned? We need sleep, but it's also watching our alcohol, tobacco, caffeine, and making sure we're feeding our bodies. Are we getting enough protein? Are we getting the things that we need in order to be happy, healthy humans? I think, yeah, that's my last one. So I am now ready. I think let me see. Let me see if I'm going to stop sharing. Okay. So I thought I saw,
Lara, we have several questions regarding sleep as it relates to shift workers here. So I can read them to you.
perfect.
And then whoever else is in the audience that want to ask a question, you can either put them in the chat or you can just speak up, all right? So what do you say about sleep to shift workers? I wear an eye mask and earplugs in every situation. And would a wearable device helpful for a shift worker too? Or is it too hard to interpret? So this is from one
No,
person.
totally. I'm a shift worker, so I end up with shifts all over the place. I have found that my wearable device has been a game changer because you're already against, you're already working with a rigged deck. You're not getting the consistency of meals. You're not getting the consistency of sleep. You're not getting those consistent things. So the wearable device allows you to figure out what are the things that really matter to you. When you can protect things, what really helps. I find that when I am really tired, I really have trouble sleeping. So I found Bose has got these little sleep headphones that I can put in, that I can put on white noise, and my brain turns completely off. I get amazing sleep that way. But it's figuring out what are the tools and tricks, and wearable technology for me has allowed me to figure out more tools and tricks, especially in those times where I know that I'm off. Like I got, I think my wearable told me I took 3 naps for a total of 37 minutes one night. And so it will let you know what's going on, but you can also look at your recovery and your rebound. Like, does it matter if are you somebody who needs to stay on a modified schedule? Can you switch back and forth with your family? You can look and figure out, and you will find that a lot of that changes with age. So it's also knowing what worked for you at 35 may not work for you at 45.
I do not see any other questions in the chat. So if people want to speak up, okay. What's a wearable? Watch?
So wearable can be my patients. There's a Whoop strap. Some of my patients have. Some of my patients have a Fitbit, an Apple Watch. I have an Aura ring. Like mine looks like this. I can't wear a watch. I don't have one on. I'm terrible about wearing one. It's figuring out what works for you. I have one of my patients has a smart mattress, and that's what works for her. I have found for me, it's whatever actually goes on your body. I went with an Aura because, again, I can't wear a watch. I've tried, I failed. So that was really helpful for me. And it's whatever you can wear and access. Like I check my app every day. I look at my app every day and I check in, like, is what my app is telling me about my sleep and my scores, because it gives me a resilience score, how my body feels, so that I can start correlating with when I feel like this is what I'm seeing. And when I feel like that, this is what I'm seeing. And this is really important with people who don't have consistent schedules, to be able to check in, because you're losing a lot of the consistent variables that the rest of the world gets to have.
That's a great point. We have another question. How much movement do you recommend per day?
What I usually tell people is it's it's cumulative. So one of the things, the reason that they had everything broken down into 10-minute increments was because that was the earliest they could measure. And so what I tell people is you want to incorporate movement into your world. So could you take the stairs instead of the elevator? Can you park a little bit further away? If you have errands to run, can you park your car in one place and go in different places? I always incorporate, like, yes, there's exercise and then there's movement. If you look at the Blue Zone data, they're just moving. They are moving their bodies throughout the day. They're dancing while they're making dinner. They are, it is figuring out, like, I have a thing under my desk called a QB, because when I'm charting, I need to be able to be seated. I can dictate to a certain point, but I need to be able to get to my mouse and stuff. So elliptical or a bike wasn't going to work for me. So I wanted something where I could stay stationary, but I could still get movement. So it's figuring out, and I've seen people with walking desks, taking meetings while they're on their headsets. However it is, we want to just be able to move throughout the day. I tell people I'm an overachiever, and so I spent a good part looking at, like, if I can't hit 30 minutes, if I can't get that workout in, I'm just not going to do it. And now I try to say every day is a new opportunity to be able to do my best. And some days that is going to be up and down the stairs on my way to do a delivery. And some days that is going to be actually going for a walk with my family or going hiking. It is meeting yourself where you are on any given day. And if I am beyond tired, my movement is going to be a massage or an acupuncture treatment to get myself back in my body. So it's really important to meet yourself where you're at and always show yourself a lot of grace and kindness, because we only get one shot at this body and this life, and we want to make sure that we're doing everything we can to protect that.
That's an excellent point. I love that idea of maximizing what you have, right? And working within the reasonable accommodation, so to speak. We have another question, and it's probably going to be the last one. What sources of protein do you recommend for breakfast?
So what I tell people is whatever is going to actually happen. Dr. Frame put in there Greek yogurt. Yeah, Greek yogurt, 1 cup of Greek yogurt is 18 grams of protein. I love Greek yogurt. Also eating non-traditional breakfast foods. Lunch for breakfast works great. I have a smoothie in the morning. I have something I've had for years. I'm actually, my entire household has some kind of protein smoothie in the morning, because that's what works best. Remembering eggs are 6 grams of protein per egg. So if we're starting to push up there, a lot of people are like, oh, I had an egg and I had some toast. And I'm like, okay, so I'm now at, 7 grams, 8 grams of protein. Again, looking at other things like, okay, I have coffee. Can we put a collagen creamer in? A little packet of Vital Proteins. Collagen is 25 grams of protein. I put that on my cereal this morning because I didn't want to have a smoothie. I'm traveling. And so I travel with these little pouches that are like, you can buy them as packets. And then I poured it over my cereal this morning. And then I could have cereal and get my fiber, but also I just also got 25 grams of protein.
Wonderful. Well, I think we're coming to the end of our time together, but it's been amazing and very informative. I've learned a lot. I see our audience is very excited, and there's a lot of feedback that's going on in the chat. So thank you so much for sparkling such a lively dialogue and giving us a lot of food for thought.
Fabulous. Well, thank you very much.
All right.